Hello everyone, and welcome back to another quarter here at Rasmussen College. As you learned from the introduction, hopefully you watched that video, my name is Carissa Legg and I'm going to be your online lecture instructor for the next 11 weeks. What I typically like to do is each week I'm going to put together kind of a mild review of the chapters that you had to read for the week and the units that we are going to be discussing, so that way you have a better knowledge of the information within those chapters. This course is really built to help you gain the knowledge on specific areas of the medical world and the structures of the systems that are included in those areas. So, without further ado, I'd like to start by going over what this chapter is about, or this unit is about, which we are talking about pulmonology. So with that, we have 3 chapters that we are focused on this week. We're looking at chapter 29, which is pages 640 to 647, chapter 51, which is looking at pages 1198 to 1210, and chapter 54, which is looking at pages 1271 and 1272. So let's go ahead and start breaking each of those down a little bit further. So to start with chapter 29, this really starts our discussion on the respiratory system. It's important that you know the organs of this system and the different parts and roles that they play. When we start talking about the organs of the pulmonary unit, we have the nose, paranasal sinuses, pharynx, larynx, trachea, bronchi, bronchioles, alveoles, and the lungs. Now, the nose is the organ of smell, and it is an important component of the respiratory system. The nose has 4 functions outside of smell, which are to serve as a passageway for air, to warm and moisten the air that is inhaled. It traps any dust, pollen, or other foreign objects in the cilia or hair-like projections, and it assists in making the sounds for speaking and singing. Your paranasal sinuses are the air cavities in the cranial bones near the nose, and there are 4 pairs of sinus cavities. You have your maxillary sinuses, which happen to be over your cheekbones, the front sinuses, which are above the eyebrows, the epidermal sinuses, which are between the eyes and behind the eyes, and the sphenoid sinuses, which are behind the epithelial. Your pharynx is a tube that lies behind and connects to the nose, mouth, and larynx. It's approximately 5 inches long and consists of muscle and membrane. The major function of the pharynx is to serve as a passageway for food to the esophagus and air to the larynx and trachea. But it also plays a role in speech by forming specific sounds. Your larynx is also known as your voice box. It's a muscular structure that is lined with mucous membranes and typically found at the end of the pharynx. Your trachea is also known as your windpipe. It's made up of cartilage that is about 1 inch wide and 4.5 inches long. The trachea serves as an open passageway for air to reach your lungs. The bronchi are the 2 main branches that come from the trachea and extend into the lungs. These are a passageway for air from the trachea to your lungs. The bronchioles are the tiny structures that are composed of thin layers of epithelial and smooth muscle. And they're typically only about 1 millimeter wide, and we have hundreds of millions on each end of our bronchi. The alveoli are small sacs that act as a support network for capillaries. They exchange oxygen and carbon dioxide, and this typically takes place in those alveoles. And obviously last we have our lungs, which are the large cone-shaped organs in the chest. The lungs are porous and spongy, and they have high elasticity. Each person typically has 2 lungs. The right lung is made up of 3 lobes, and the left lung is only made up of 2 lobes because it has to incorporate the heart. Each lung is about 10 to 12 inches in length, and that this is universal for everyone. The breathing process, now that we understand the organs, is something that needs to really be discussed. As we discuss breathing, it's the movement of air to and from your lungs, and that's called ventilation. This process is made up of one inhalation and one exhalation. Inhalation is the process, the active process that involves taking a breath in. It's also called inspiration. Your exhalation is a passive process of exhaling or breathing out a breath. That's called expiration. If a patient is having difficulties in breathing, that's typically a term we use called dyspnea. If a patient has a lack or an absence of breathing for more than 19 seconds, that's called apnea. And if a patient has difficulties in breathing in certain positions, that's called orthopnea. So that kind of wraps up chapter 29. We're going to move into chapter 51, which is talking about the study of pulmonology. And pulmonology is really the study and treatment of respiratory diseases and respiratory systems. It includes the trachea, bronchial tubes, lungs, and alveoli, which we've all discussed previously in chapter 9. The primary function of the respiratory system is to transport oxygen from the lungs through the bloodstream to all the cells in the body and carry any waste products from the cells through the bloodstream to the lungs to be exhaled from the body. Now, as a medical assistant, it will be important for you to understand what your role is and what your part is of helping the provider to diagnose conditions and diseases that are related to the respiratory system. This can be done through the process of a pulmonary function test. It may also be through a spirometry test, arterial blood gases, lung volumes, or pulse oximetries. So let's take a look at each of those individually. A pulmonary function test is also called a spirometry test. This is a non-invasive test that measures the ability of the lungs to exhale. The results reflect elasticity of the lungs, their ability to ventilate, and the strength of the respiratory muscles. Now, as a medical assistant, you will play a very important role with this procedure as you prepare the patient, but you also coach them throughout the entire process. You have to be their cheerleader and you have to coach them through this if there's any chance that they're going to have a successful test. Next, we have arterial blood gases, and an arterial blood gas is the measure of the amount of oxygen, carbon dioxide, and the pH level of the blood. This test typically helps to diagnose patients with COPD, or chronic obstructive pulmonary disorder, and pneumonia. When we look at this, the pH of our blood is typically somewhere between 7.35 and 7.45%. Obviously, when you're drawing an arterial blood gas, that's coming from an artery versus that of a vein, so please be cautious about that and know that typically medical assistants don't perform these as you have to have specialized training in this area. Next, we have our peak flow meters, or we can also call these lung volumes. It measures the patient's ability to move air into and out of the lungs. Typically, we do this with asthmatic patients, and we have them do this on a daily basis. They keep a diary of their averages, and what they do is they do this 3 times, typically first thing in the morning, and then once they get home from either work or school, and they write down their averages. So they do this 3 times and take the highest or the average of the 3. Then we have your oxygen saturations or pulse oximetries. This determines the oxygen concentration in the arterial blood. Your normal oxygen saturation is anywhere from 95 to 100%. And when you're doing this, a couple of things that you want to look at are you want to make sure that the fingertip that you're doing this on is typically warm, has no nail polish. You can also use the earlobes. For children, you can use their heels or their big toe, but typically you want to say for adults around the fingertip areas. So if they have some cold fingers, have them sit on their fingers for just a few minutes. The last part of this chapter that I really want to talk about is TB testing, and this is also called a Mantoux test. What we're doing is we're testing for tuberculosis, and it's characterized, or its symptoms can be coughing up blood, which is also called hematosis. When you're performing a TB test, that is placed just under the first layer of skin using an intradermal method. And you want to read those results within 48 to 72 hours. If a patient does not come back in that time, you do need to make sure that you have them repeat the entire procedure. All right, and we're going to finish up this video with chapter 54, which is looking at not only treatments for pulmonary disorders, but also common pulmonary diseases. So in those couple of pages, there are 2 pages that you have to read, it talks about the routes and methods of administering medications. With the respiratory system, the main way that you will administer medication is through an inhalation method. Now that can be either through a nebulizer or an inhaler. Inhalers are more common as they're handheld, and patients can do these themselves, but you may have to actually show them how to use that device. Where a nebulizer takes a liquid medication, turns it into an aerosol that then can be breathed in through the lungs. Either of those can be done in the clinic or in a home setting. And then we have the common disorders that are associated with this system. Big ones are COPD, bronchitis, pulmonary edema, and croup. I'm going to leave those for you guys to read on your own. You can also have Legionnaire's disease, pleurisy, asthma, and pneumonia. Again, I'm going to be leaving those for you to read. I will put out these PowerPoints so you can have them. And typical medications that we use within the pulmonary unit are antihistamines, anti-inflammatories, antitussives, bronchodilators, decongestants, and immunosuppressants. I'm again going to leave all of this for you to read on your own, and it is within your book as well. So make sure that you're reading those, not only the tables, but the different chartings that they give you, because that really helps to kind of break down what each of these medications does, as well as give you some typical examples of what those medications are. Now to wrap up chapter 29, 51, and 54, I like to give you kind of what's your homework for the week, or what do you have to do for the week. So each week you'll typically have a discussion board and a quiz. That's how this course is built. So for your discussion board this week, we are discussing the spirometry preparation, or the PFT preparation, and the coaching method. What you'll need to write on your discussion is what you think is the proper way to prepare a patient for this procedure, as well as you will need to explain what the purpose and the importance of coaching a patient through the test are. Please make sure that your initial discussion post is completed Tuesday, October 3rd by midnight, and that you reply to at least one classmate no later than October 7th by midnight. Now, I will do some replies as well, and I highly recommend that you reply to me, especially if I ask you some questions, but a reply post to me as the instructor does not count for your grade. I also highly recommend that you check out the class rubric, or the discussion board rubric I posted in the module, because that will explain what I'm looking for in a post. And if you head over to the general course questions, I've put in there what I'm looking for, what a good what a good discussion post is, as well as what content needs to be there. You'll also have one quiz this week, which will be due October 8th by midnight. This is an online test, so please give yourself time to take it, as you only get a 20-minute limit. If you have any questions or comments, always reach out to me, and happy week 1, everybody.